Hey Tupelo, Dr. Carver here from Carver Chiropractic coming at you with another quick video. Now I had several people message me and tell me that my last video on headaches really helped them out, and that's fantastic. That's exactly why we do what we do here. A couple of people have also messaged me with questions about lower back pain. The truth is, low back pain is incredibly common. Actually, about 80% of people will experience it at some point in their life. So I thought that would be a great topic for today's video. Now, low back pain has been in the national news lately. The American College of Physicians has just released their new treatment guidelines for doctors treating low back pain. They're now recommending that doctors begin treatment with non-invasive and non-pharmacological therapies first. This is a big deal because it means before trying things like pills, injections, and surgery, doctors should begin treating low back pain with less invasive therapies like exercise, massage, and of course chiropractic care. Now, this doesn't mean that all medications and surgery are bad. There's absolutely a time and a place for those things. What it does mean is that patients should begin their treatment with safer, non-invasive methods first, and if these don't produce the results they want, then they can move on to those riskier, more invasive therapies. What they found is that the majority of patients will respond to the safer, conservative treatments and never need those medications, injections, and surgery. And any good doctor will tell you, if you can avoid those things, you are better off. So, what does that mean if you've got pain right now? Well, the first thing you need to do is get to your healthcare provider and let them check you out. Pain is always your body's way of telling you that there's a problem, so get yourself looked at right away. Your physician will need to do a few things to determine what the cause of your pain is before they begin any treatment. In most cases, you'll need a thorough exam, maybe some range of motion and postural tests, maybe some orthopedic testing, maybe even some neurological testing depending on what your symptoms are. They'll also most likely need to see some imaging like an x-ray so they can diagnose the problem. The bottom line is if you can see it, you can start to make a plan to fix it. Now, I'm a chiropractor by trade, so obviously I'm going to recommend you start there first. We specialize in safe, non-invasive treatments, so you can usually get all the treatment you need from start to finish right under one roof. For instance, in my clinic, a common treatment plan might include things like exercise, muscle stimulation, chiropractic adjustments, maybe even cutting-edge therapies like deep tissue laser and spinal decompression, all of which are safe, non-invasive, and very well researched to be extremely effective in producing fast results. Now, I've put together a list of tips and suggestions for dealing with your back pain, especially if you're at work. So whether you work in an office and you sit all day, or you're a factory worker and you're on your feet a lot, these tips should be super helpful while you're under treatment. It's totally free. You can check it out over my blog. I'll leave a link in the description. So if you found this helpful, show us a little bit of love. Hit that like button, hit that share button. As always, if this sounds like you or someone you know, please give us a call. We're here to serve our community and we would love to help. Have a great day. God bless.